movement of food through the small intestine, and then it becomes fecal matter in the large intestine, going out in a timely fashion, one meal in, one bowel movement out. In this diagram, we're observing a sluggish bowel in which several meals are backed up in the large intestine, which is the result of constipation and certainly produces toxic bowel syndrome. You're supposed to have 2 to 3 bowel movements a day if you're eating 2 to 3 meals a day. The bowel movements should be effortless, odorless, and well-formed, and leave you with a feeling of satisfaction and cleanliness when you're finished. Dr. Norman Walker, who by the way died at the age of 109, was one of the foremost pioneers in colon health. He stated that out of 100,000 autopsies that he had attended, there were less than 10% normal colons. Dr. William Hunter said, "The colon is the sewer system of the body, but with neglect and abuse it becomes a cesspool of toxins that spill over into the body." Let me tell you the true definition of regularity. If you eat a meal, you have a bowel movement. You eat 3 meals a day, you should have 3 bowel movements a day, just like a baby. You feed a baby, 20 minutes later, it has a bowel movement. So let me ask you a question. If you're eating 3 meals a day, but you're having just 1 bowel movement a day, or maybe 1 bowel movement every 10 days, as some patients tell me, sometimes once every 2 weeks, believe it or not. Question, what's happening to that food? What's it doing to our body? You're about to find out. Here's a diagram of the normal colon. Notice the ascending colon, transverse colon, descending colon, sigmoid, and rectum. Look at this example of how toxic a colon is. Look at the cross-section of the colon, only leaving a small passageway to eliminate. This waste builds up, causes poisons, which are then absorbed into the body. This is what happens to our colon when we ignore the body's urgings to have regular bowel movements. Let me ask you a question. What would happen if you were to put a hamburger in a Ziploc bag and left it in your kitchen counter? What would it smell like after a week? Or even worse, what would it smell like after several years? This is what's going to take place in our bodies if we are not eliminating properly. Here are some actual x-rays of people with colon problems. Notice the white areas, that's the colon. Notice how distorted, how prolapsed, convoluted these sick colons are. Serious health consequences are going to result as a result of these colons that are not healthy. In this diagram, we see what's known as a spastic colon. This is the result of stress. See how the colon is contracted in spasm. Obviously, this will hinder bowel function. This is a direct consequence of stress. This certainly sets the stage for serious health consequences as this fecal matter remains in the colon for years. One of the most serious consequences of not taking care of a colon is something called a colostomy. And this is where the surgeons remove the colon and the bowel matter passes out through a hole in the abdomen into a sac. Let's spend some time talking about a major health problem in this country, and that of weight problems. According to the Surgeon General, over 61% of the adult population is overweight. That's awful. That's tragic. There are several factors relating to toxic colon that can contribute directly to weight problem. Toxic accumulation in the bowel. As I've said before, the colon can expand up to 5 times its normal size. This swells up because of the toxic waste that's not being eliminated in a timely fashion. This leads to that condition, megacolon. This is the enlarged colon. Dr. Jack Lemire, a naturopath and a homeopath, said most people are walking around with at least 7 pounds of fecal matter in their large intestine, and I have seen patients lose that much weight and their tummy bulge following colon therapy. Nutritionist Lindsay Duncan agrees that a clean colon aids in digestion and the ability to metabolize food. I quote, "They think it's normal to have a bowel movement once every few days. I often startle my clients with the question, if we eat 3 meals daily but only eliminate once a day or once every other day, where do you think all the rest of that food is hiding?"